we've seen a slower increase of COVID-19 positive cases in the past few days, and I'm sure all of you have been noticing that. I ascribe this reduction in the rate of increase to the following factors. Firstly, we closed the borders and reduced importation of the infection. A large number of infections were driven by people who had been to those particular areas that are already affected. Secondly, enforcing quarantine of the inbound travelers and returning citizens has slowed down the infection from traveling community to a resident community. It's been a very strong factor there. Thirdly, the lockdown has slowed internal transmission by reducing the risk of spread through large gatherings, churches, football and festivals and so on, and also overcrowded transport routes such as trains, buses and taxis. Internal transmission has started, and it may have a tendency to spread silently as people with less means and slight symptoms may be slow to seek medical help as they are few and far apart. Excuse me. So what it basically means is that those people who might be having mild symptoms, if they are in poor areas, they may not seek assistance immediately. But it's one person there, it's another one very far, so that means they are not actually going to be appearing as a big number of people, as it were. The second issue is that our testing criteria of patients with symptoms is reactive and restrictive. In other words, you have to show yourself up because you've now got infection. That's how we've been testing up to now. This means that we don't have yet a true picture of the size of the problem. We need to test hundreds of thousands of the population to get a better picture to refine our containment strategy. That's why I say even though we're talking about 47,000 tests, that's still far too low because of the nature of our country and the nature of the disease burden, the inequalities, as well as the population size that we're dealing with. The lockdown may have the inadvertent effect of limiting access to health facilities for those who depend on the public services in poor and densely populated areas and other underserved communities because of transport difficulties. This means that the release of a lockdown may have a huge rebound effect on releasing every constraint that made the infection slow down. And we may have a runaway train with no way of applying brakes. That's the vigilance which we must put into the whole situation. Therefore, we need to engage all community leaders and call for volunteers in community and civil society formations to support the campaign against COVID-19, spread the message, and teach our people to take the containment measures more seriously and support all the affected individuals and families. The message of stay at home and the importance of hygiene must be made more emphatically. Next month, the flu season will start, thus making more people sick with similar symptoms, with no way of distinguishing common colds from an upsurge of COVID-19 infection. These will flood our hospitals and clinics and create a fertile ground for coronavirus to spread or to be masked in its presentation. This means this small growth in numbers we may be currently experiencing the calm before a heavy and devastating storm. We will also be seeking reinforcements from some of the countries that might be able to assist. For example, we have approached the presidency to approach China and Cuba to actually assist with reinforcements. So hopefully those in the next couple of weeks, we should see some of them coming to reinforce. The advantage of China is that they've just gone through the same, so we'll actually be wanting to use that experience. But the advantage of Cuba is that their community and district health model is actually one that we'd like to use because it works for instances where you'd like to be able to reach out to many communities and ensure that there's a good cover at community level.